Welcome to our new video. Today I am going to discuss about Ramsay Hunt syndrome. Yesterday our famous singer Justin Bieber, singer from the Canada, he released one video. In that video he said that he is affected from this condition. So today I am going to discuss this Ramsay Hunt syndrome details. Today in this video I am going to discuss about this condition, along with what is the causative agent of this condition, what are the clinical features of this condition, how will you diagnose it, after the diagnosis what is the treatment plan, and what about the prognosis if we not treated it, and what are the complications, and finally how we will prevent from this condition. I will discuss details in this video. Now there are some name of Ramsay Hunt syndrome. There are some other names, like some people also call it herpes zoster oticus, or some people also called it geniculate ganglion zoster, or some people are also call it herpetic ganglionate and geniculitis. These are the other name of Ramsay Hunt syndrome. Now let's discuss what is the causative agent of this condition. It is one viral infection caused by Varicella zoster virus infection. That is Varicella zoster virus is the causative organism of chickenpox and seizures. So it is one viral infection. Now, what are the clinical features of this condition? The clinical features of this condition is there is a severe pain around the ear region. There is a severe pain around the ear region, and there is the painful rash in eardrum, which we will see by doing otoscope. And there is the rashes around the external auditory canal. And there may be rashes on the external ear, like the ear lobule pinna. That is the rash, and there may be rash in the soft palate also. And other clinical features are the vertigo and patient unable, there is the weakness or something, heaviness in the one side of the faces, unable to hear in one ear, and there is the food stuck in one side of the cheek, and dribbling of the saliva, dribbling of the water during the drinking of the water. These are the clinical features of this condition. Now, after the clinical features, I am going to discuss how it is diagnosis. If this condition occurs, a medical person or a doctor, how he or she diagnose it. This is mainly a clinical diagnosis. We can diagnose it by doing the clinical examination, and I already upload how to examine the facial nerve, and I will provide the description of that video I will provide the link of that video in the description below. You can go through this. Solely it is a clinical diagnosis, but there are some other tests by which we can become confirmed. That other tests are the blood test for the varicella and zoster virus, electromyography means we can see the electrical activity of the muscles, and MRI of the head and neck region can be done, and nerve conduction test, mainly the nerve conduction test of the facial nerve is done here in this condition, and skin prick test for the varicella and zoster virus. What is the treatment modalities after the infection? If the infection is suspected, if you diagnose a case of the Ramsay Hunt syndrome, how will you treat this condition? The first line of the treatment is, always remember that the first line of the treatment is a physiotherapy. Second is anti-inflammatory drug like prednisolone can be given, and antiviral agent like acyclovir can be given. And in this condition, person unable to close the eye, so during prolonged open of the eye there is the corneal abrasion, so we have to treat this corneal abrasion also. In the daytime we will give antibiotic or ointment, and in the night time we can give eye pads or eye pad, soft eye pads or eye pad can be given. Now let's discuss about the prognosis. What if the person is infected, or if the person has Ramsay Hunt syndrome? What is the prognosis of this condition? The prognosis is, if there is a little damage to our nerve, then the person completely recovers within the few weeks. But if the damage is more, it takes prolonged time to recover fully, or there may be chance of the some weakness also. Full recovery may not occur if there is the damage to a nerve fully. And how can you say that there is a few damage or more damage? Few damage or more damage can be diagnosed by doing the nerve conduction test. I already mentioned in the investigation we will do the nerve conduction test of the facial nerve. Now one thing I have to mention here is the onset of the treatment plan. When you will start to treatment, we have to start the treatment as fast as possible, because if we start the treatment within 72 hours of the onset of the symptoms, then the recovery is then the prognosis is excellent prognosis. That means around more than 97 to 98%, more than 98% people will recover fully. There is no any weakness, so we have to treat the patient as fast as possible. If we start the treatment within the onset of the 72 hours of the symptoms, then the prognosis is excellent. That is, more than 98% of the people will recover fully without any weakness. If we start the treatment after 72 hours or 3 days, then the prognosis will not same like that of the previous one. So treatment should be done as fast as possible after the diagnosis. Now, if we not treated this patient, if the patient will not take full drug, or if it is a neglected case, what are the complications that may arise by if we not treated properly? The complications that may arise are disfiguration of the face. There may be the loss of the movement of the faces, and that is a loss of taste sensation, loss of the hearing. And I already mentioned that there is a person unable to close the eye. Due to unable to close of the eye, there is the corneal abrasion, corneal ulcer. Finally, there is a loss of the vision and person becomes blind. And other complications are neuralgia. It causes the severe pain and spasm of the muscle of the faces. Now, if a non-medical person, when contact with the doctor, in what condition non-medical person we have to go with the doctor? If there is any problem in the movement of the face, if there is any problem in the movement of the faces, or if there is any alteration of the taste sensation, person unable to hear properly, if there is any rash around the face and facial area, we have to consult with the doctor. And prevention, there is no exact prevention, but if we same things, that is on treatment. When we treat, there is no prevention, there is no any actual prevention. But if we treat the patient as fast as possible, that is within 72 hours of the onset of the symptoms, then the complications are prevented. More than 98% people will recover fully without any residual weakness. So we have to treat this patient as fast as possible after the diagnosis of Ramsay Hunt syndrome. All for this, if you like our video, please subscribe our channel and share this video to your friends. Thank you.